Hi Todd, it's Dr. Buford. We're just getting started on your left knee here. We're looking in the medial compartment. This is the inside part of the knee. There's been a few little loose pieces. You can see them there floating around. We're just using the suction on our shaver to clean out the knee there before we even get too far into the surgery. This is a little piece of what we call the ligamentum. We can remove so we can see a little bit better. Back of the knee on the inside here. Again, you can see a lot of loose pieces floating around. Magnify, you see a little bit of fraying on the meniscus. That's not too bad. We're going to get a probe here in just a minute. Probe it, see how stable it is. So we did get back into some of the meniscus where it was torn. This is exactly what the MRI showed. We just trimmed back a little bit to make sure none of that's going to tear any further, and we've just been polishing the edges of this. In just a minute we're going to look in a different compartment. But now we can... Okay, so that's looking pretty good now. We're going to look in the central part of the knee next. This is where the big ligaments are, the anterior cruciate, posterior cruciate. The ACL runs back up here. It's behind a little bit of tissue there. That looks just fine though. And the PCL is back behind here on the left. Breakdown of the cartilage in the trochlea. This is part of the knee where the kneecap slides, and normally it's a nice smooth surface, and in your knee it's very rough and irregular. I'm going to get you a clear picture as soon as you get a little more fluid, and you'll be able to see exactly what we're talking about here. Right where my shaver is, all this is exposed bone. Way out on the edge, you can see the normal white articular cartilage is right here, but then right where my shaver is where it stops. And these edges are kicking off these loose pieces, and those float around the knee and create an inflammatory reaction sometimes, make the knee swollen, and if it's a big enough piece, it can even cause some of those sharp pains and clicking and occasionally even some locking, all of which I think you've had before. So the one thing about doing the arthroscopy, this always actually stirs things up and makes it a little bit worse before it gets better. So just keep that in mind. It wouldn't be uncommon for you to have some swelling and to actually feel like the knee's a bit swollen for 3 or 4 months sometimes, at least a little bit swollen, until things settle down and then hopefully you're better. It's kind of like kicking a hornet's nest. So we're just smoothing out the edges right now. See how these edges are a little bit rough. As you look up at the patella, it's interesting, the patella doesn't look that bad at the top of the screen. It's really just the groove that the patella slides in so far. Okay, so we've tried to firm up the edges of this defect. It's pretty large. This is, I'm outlining the whole defect here. It's most of the trochlea, this whole thing. And this is the lateral side here. The lateral edges were really kind of irregular and flaking off. We really tried to work here to smooth this up. And I don't like having to use this device, but I don't have any other way to try and seal these edges right now. We've already used our shaver. Okay, so that's about as stable as I can get that part of the knee. Now we're going to look in the lateral compartment. Pause, please. Okay, so this is the lateral compartment of the knee now. And we see some wear and tear changes in the cartilage, but not as bad as the trochlea. I think that trochlea is clearly going to be the worst part of the knee. As you look in here, you can see some kind of degenerative fraying of the meniscus here. You can just make sure that it's stable by using our shaver and a suction. Okay, we're just finishing up here. We're going to be getting you back to the recovery room in just a few minutes. So hopefully this will give you some relief. And by cleaning out the knee a little bit, giving a little bit of a washout, this will give you some relief for an extended period of time. So good luck to you now. Bye-bye.